Varicose veins, everybody knows about. Unlike some of the other things that we deal with at the San Diego Vascular Center, varicose veins is a very common problem. Affects 25 million Americans. If you look at your family members, almost invariably somebody has varicose veins. And in general terms, 1 out of 4 people will have varicose veins. There are different types of varicose veins. And so you can have small spider veins or you can have huge varicose veins. And it has to do with pressure in your blood vessels. And with time, the pressure in the veins makes them bigger. The question is, why is the pressure higher? And sometimes it can be something simple, like you're standing all day long at your job, and you may need to wear compression stockings to help support your leg a little bit. But sometimes there's an issue with a blockage or incompetent valves, which allow the blood to travel in one direction to get back to your heart. So if we can find this issue earlier, then we can fix it and get better results later. The screening is an ultrasound test, and we can take pictures of your veins, just like we take pictures of anything else with an ultrasound machine, and we can tell how your blood is flowing, and we can tell if there is a problem with your veins in your leg or anywhere higher from your legs up to your heart. Most people that we see for varicose veins are people who have symptoms in their legs. Now, the symptoms may be vague, like fatigue, aching, tiredness, or they can be more significant, like swelling and pain. And a lot of the people who see us for cosmetic reasons, it is done to improve their quality of life. They feel better about themselves. They're able to get out and do the things that they weren't able to do. And for varicose veins specifically, it's very interesting because all of us have different ideas about what we look like and what we should look like and what we can do or cannot do. For example, men are notorious for coming in to see us with very late stages of the disease, because generally men feel that, there's no problem unless it becomes a really bad problem. And a lot of the times it's their significant other who tells them to come in to fix the problem, because the problem gets to be so bad that people start to get ulcers from their varicose veins, and the skin changes, and it's difficult for them to carry out the usual daily activities like walking. For women, it may be just something simple as not wearing shorts. And it's something that we frequently hear here, that I haven't worn shorts in years. Problem with varicose veins is it's very common, and it takes many years for the problem to get worse. So you can live with it for many years, and there's no specific health concern unless you have one of these underlying problems, which may cause more serious, life-threatening issues like blood clots. And blood clots is a very common problem in the United States. And unfortunately, once you develop a blood clot, and if that blood clot travels to your lungs, again, it's a life-threatening condition that may be preventable by screening for it. The idea that we're trying to promote is, if you screen these patients earlier, you will get much better results. And it's the durability of results which is most important. Because a lot of the times, the treatment for varicose veins, which is very simple, unfortunately, the varicose veins is a hereditary problem, and the varicose veins tend to come back. But we try to screen patients for an underlying cause of their varicose veins. And if we can find an underlying cause and treat it, the problem will go away. And your risk of having an issue with your varicose veins 10 years, 20 years, 30 years down the road is negligible. Rather than waiting for the symptoms, the idea is, well, come in sooner so we can screen you to see if there is a problem, and then we can talk about your options, and then you can make a decision whether or not you want something done about it.